The Senior Reset podcast delivers education and resources to help seniors and their families set themselves up for success. Each week, we dive deep with medical professionals and industry leaders to bring you answers to the questions that matter most. From the latest medical advice to financial strategies to staying ahead of scams, we'll build the toolkit you need to thrive. Here's your host, Joel Stewart.
Hey, everybody. Welcome to the Senior Reset podcast and event. We are talking resources, education, solutions, entertainment, and training for the senior community and their families. Today, we've got a great show lined up for you. We are going to be talking with our very own co-host, Nicole Farmer. We are going to explore everything related to caregiving. So who can be a caregiver? What's it like to have a caregiver? What happens if your caregiver isn't what you'd like them to be? And who qualifies for that kind of stuff. So if you are actually thinking about being a caregiver, or you are someone looking for a caregiver, this is going to be a very enlightening episode. So, hey, Nicole, how's it going?
Pretty good. How are you, Joel?
I'm doing well. So I guess to kick this off, let's talk just a little bit about the basics. So what exactly is caregiving? Can you just kind of give me a high level overview?
I can. So caregiving is a combination of things. It can range anywhere from skilled services to non-skilled services. So in general, caregivers on the non-skilled side are going to be someone that comes in, does light housekeeping, meal prep, medication reminders, all the way to someone that may be skilled and certified that can come in and help with bathing, dressing, toileting, grooming, more hands-on type stuff. So basically someone that's coming in and assisting a person with their activities of daily living to better assist them to stay independent and to stay in their home a little bit longer.
I mean, that is kind of the goal of it, right? It's caregiving is all about trying to keep people in their homes, or as close to that as possible for as long as possible. Is that about
aging in place with dignity is how I like to say it. Like our job is to go in and provide the support that they need to stay as independent as they can, to keep their dignity intact, and hopefully prevent them from being frequent flyers in the hospital or stuck into a nursing home or an assisted living type setting. So that is our goal, is to keep them in their home as long as possible.
So who exactly can be a caregiver?
Quite honestly, a broad answer is anyone. I mean, there are certain regulations and rules, and those do vary state from state, but overall, you need to be able to pass a background check, meaning you don't have any felonies or any major violations that would keep us from hiring you. And those state regs vary a little bit too. You need to be able to pass a physical examination from a doctor that says you are capable of doing this job, you're free of any kind of communicable diseases. Most states require a TB test. At Signal, we go ahead and get those up front anyway, because we keep it consistent across the board. And then there's competency checks that you need to go through to make sure that you at least have a level of understanding to provide the care. And if not, we can educate you. If you decide to go even further in and be skilled, then there are things out there where you can get licensed and certified in different states. At Signal, we will help with that process, and some agencies do that as well. So really anyone can. We have daughters that come in and care for their mothers. We have grandchildren that care for their grandparents, neighbors that are looking in on someone anyway, maybe need to get hired and find out if there's an avenue to get them paid. So again, really anyone, as long as they meet the state requirements and the background checks and all the things that we have put in place to provide safety in the home as well. Good caregivers.
Well, that's really interesting. So I focusing in on that, I bet there's a lot of people out there that are doing caregiving already and not realizing that they get paid for it through the state if they qualified for Medicaid or
absolutely
long-term care insurance.
Absolutely. And there's multiple different avenues to do that. You can be hired directly through an agency, which is usually a little more pay because the state kind of caps that off if you go through a structured family plan. So there are different avenues to get paid, but the concept is most people are losing hours, quitting jobs, taking time off, neglecting their family, whatever the case may be, to put in all the work that a family caregiver does. And there are avenues to get you paid for that, which is sometimes a hard concept for families to accept, but ultimately someone can get paid for them anyway. It benefits you and your person. It's a nice way to have someone in there that caring for you, so you don't have the fears that we're going to talk about later.
Now, I know we talked about this a little bit in some of our previous episodes, but who qualifies to have a caregiver?
Now that's going to depend too. If you have the means and the funds to pay privately, again, anyone, if you're kind of declining a little bit, maybe you don't have Medicaid, your Medicare type stuff is not going to cover these services we're talking about. It's going to be more of a state funded program or a private pay type thing. So private pay options, anybody. I mean, we could come in and help you do housekeeping and meal prep and just not a whole lot of the medical stuff. We can do more medical stuff, private pay. So anyone can qualify on that end. As far as like other insurances, long-term care does cover that. So a person that has carried long-term care insurance, we would have to check the benefits, but typically there's, a few $1,000s a month available for caregiving on those. And then you kind of just go down from there as far as what your income can be. And if you qualify for state funded programs, there's either, traditional Medicaid type services straight through the state, or each state has some type of waiver program, maybe called something different in different states. It's Medicaid Aging and Disabled Waiver in Indiana, but it could be called something different. So those avenues, there's a lot of things that go into that. How much assistance do you need with your daily livings? Typically to qualify for waiver, you need to have at least 3 things you need help with. You're not skilled nursing level care yet, but you could be if you get much further on. So kind of those kind of things. If it's non-medical and they qualify for a waiver type service, it's just as simple as setting them up. Now, if they're Medicaid and they need a more of a medical type service, then we do have to get a doctor's order and make sure that you qualify through your doctor, check your Medicaid and that kind of thing. But really, it's a situational thing. It's case by case. So everybody could qualify in one way or another. We just have to find the right way to get them paid and what services they need. So we look at every referral independently to see if we can help.
So what do people generally need help with to qualify for services? So there's a lot of these different state services, but I imagine like a healthy individual, anybody would want help with laundry and cooking, I suppose, if the state would pay for it. But I imagine there has to be some sort of physical limitation.
There does. Again, there has
seniors
to
are
be,
bumping up
and
against.
there does. And I can give you a general, I don't know the exact ins and outs of what happens when like waiver qualifies for someone, but I know typically to qualify for a waiver program. So waiver is basically kind of like Medicaid, only it's just a separate pocket of money that it comes from. So if you qualify for traditional Medicaid, chances are you might qualify for waiver, but at that point you have to show a need for assistance with your ADL. So it's harder for you to get dressed by yourself. Maybe you don't need someone to dress you, but you trip up a little bit when you try to put your pants on, or maybe you don't need someone to bathe you, but you get a little nervous in the shower. So we can send someone to stand by, assist you. So if you can show that you have those kind of needs, again, all of the qualification would be ultimately up to the area on aging and their specific guidelines. But in general, if you need help with your ADLs, your activities of daily living, and you qualify for a Medicaid program, it's pretty likely we could probably get you qualified for waiver.
Gotcha. So if somebody's kind of struggling at home with, so the activities of daily living, that's like cooking, cleaning, dressing yourself, bathing, hygiene. It could be a whole lot of different things.
Yeah, I mean, it's a concept. It's an overall view of everything you just said. So the things that you do on a daily basis that keep you independent. You get up, you dress yourself, you brush your own teeth, you brush your own hair, you are able to put your own clothes on, you're able to cook your own meals, you're able to do all your dishes and not have to take breaks, So those are the kind of things that if you see yourself declining in, we can step in and see if you qualify. And maybe everyone doesn't qualify, but we take every situation on a case by case basis. So we're going to look at everything you have and everything that you need and find an avenue that we can try to help you is kind of the goal.
Yeah, I imagine that that families might actually have a better view of when someone might need a service like this. It's kind of like if your mom or your grandma is like calling you over constantly to assist with bathing or to cook meals or to clean the house because they can't do it anymore, that might be a good indication that, hey, if they need me to come over and help, they may need a caregiver, or, I may be able to get paid to go over there and help through an agency like
you're exactly right. And that's again where it's like a situational thing. And family members that are listening that have people that are declining, and maybe you're spending a lot of your time running yourself ragged. I mean, my mom did it. She took care of my grandparents till they died, and so she had to find this balance between her kids, her life, and us and them, and it's a lot. And she took care of my aunt too until she passed away, and my mom chose not to get paid for it, even though she could. And I know that's a hard concept for families, but truly, if the money's out there, even if you don't want to take the money for yourself, like it's helping you provide care for your loved one. So I know that's a hard concept sometimes for people to swallow, but it's hard for mom and dad to know that they're ready for that kind of assistance too. Because when you do try to qualify for these programs, you need to be as honest as possible about where you're at. A lot of the seniors that we work with are like, oh, I'm okay, and I don't need this. And yeah, you probably are okay, but it's our privilege to be able to come in and help you. So it's okay to admit that you need that. And for the family members, when I meet with families, I try to encourage them, like, you're no good for anyone if you're not good for yourself. Like, at least let us come in. There's also respite services where we can come in and just give the caregiver a break for a couple days. There's a lot of things out there that caregiving is hard. It's hard work. It's hard work for the people that we hire and pay to come in and take care of your loved ones, but it's definitely a lot harder when it's your family member and you're adjusting your whole life and watching them decline at the same time. So that's where we're perfect to step in and take some of that burden off. And, not that you don't love your loved one, not that you're not still caring for them, but let us help you kind of concept.
Yeah, it's certainly, I imagine if you're setting up like a thing where a family member is taking care of family, it's got to be a lot easier to carve that time out of, all your other responsibilities if you were getting paid for it. But again, with the seniors now that are getting up in age, in the late 80s, 90s, they grew up in the Great Depression. They're very self-reliant, from my experience.
Which honestly actually brings us to a topic that we didn't discuss, that I didn't touch on, is seniors being caregivers, because you're absolutely right. I mean, some of our best caregivers are seniors. I mean, even if you're on a fixed income, usually you can make around $200 a month still. And if you're checking on Susie down the street anyway, like, seniors, some of the seniors that we have on staff are some of the best caregivers that we have, and they relate better, just like our, how we kind of go after veterans to take care of other veterans. Like, we try to find the right people for the right people, and we try to find the right fit. So yeah, you're absolutely right. Seniors are amazing caregivers. If they are still at that point in their life where they're very self-reliant, they don't need us yet, they can step in and help other people that need us.
Yeah, it sounds like it's a lot of interesting combos here. But so with all of these things, it's what we've just spent all that time talking about is seniors and family members or friends taking care of each other. But I imagine it's got to be really hard for seniors to kind of mentally wrap their heads around having a stranger come into the house. So, when somebody really needs that assistance, but there isn't friends or family that can come over and take care of them, and they're just reaching out to an agency and saying, "Hey, I need help." Do you find that there's a lot of pushback from seniors, or that it's really hard for a senior to kind of wrap their head around the idea of a stranger coming in and taking care of them?
Yes and no. I think typically by the time they get to me, somebody has eased their mind a little bit. By the time they get to me at the agency, somebody has calmed them down a little bit, but that doesn't mean they're not going to have apprehensions when we send people in. So a safeguard for that is that we do at Signal, at least, these, I can only speak on our regs, but everyone should be following these. Like, we do a state background check. We do a federal background check in our franchise locations where fingerprints are required. We do that. I mean, we make sure we do things, we vet them as thoroughly as possible to make sure that we are doing the best we can to send good quality caregivers in. But again, at the same time, we're dealing with humans, right? So yeah, it is a little scary to let a stranger come in and try to take care of you in your home, especially with you're not quite ready for in the first place. And then a stranger coming in. Yeah, absolutely. Those things can make it a little difficult and a little scary, but that's where it's the agency's job to do pop-up visits, which is another safeguard we have in place, where we show up in the homes, we make sure that they're doing what they're supposed to be doing. There's a lot of different things that we can do, and communication is key. If you're feeling uncomfortable and this is with Signal or any agency, you have every right and responsibility to speak up with what you're concerned about with your caregiver. And it is the agency's job to step in and look into that. There's not always going to be perfect matches every time you put a caregiver with a client. So we'll do trial and error, and we'll find someone that you're comfortable with, but we have to know what you're uncomfortable about. And I do see a lot of seniors hesitate to speak up. They don't want to go into a nursing home. They don't want to get someone in trouble. They've made a connection. They're friends with these people. It all happens in home care, but it's your responsibility as the patient too. It's our responsibility to give you good quality care and to provide you with good caregivers, but it's your responsibility to let us know if that's not happening so we can fix the situation.
So is it fair to say that in a in a situation like this where you have a senior and a caregiver, and maybe the senior is fairly uncomfortable with their caregiver for whatever reason, that the senior can speak up to you, and that you can arrange to have their caregiver replaced, and that there should be like an open dialogue between, the senior and the agency, about their caregiver and how the caregiver is doing, because feedback, I imagine, is very important in making
It
sure that
is.
we have good matches here.
It is. We can only handle what we know. We can only deal with problems that we know exist. So if you're putting up with something, and it happens more often than not, and it's really very tragic and sad when it does, that patients are afraid to speak up across the board in nursing homes and home care. You're afraid to speak up, like these people are responsible for taking care of them, and they're afraid of retaliation, or they're afraid of whatever it is. I just try to encourage them, and we talk to them about our grievance policy and all of those things up front. If you have a problem, you have to let us know. We can't fix it if we don't know it's a problem. And we will step in and investigate and find out the problem. If the caregiver needs to be eliminated completely, that's fine. Is it just not a good personality match? Maybe. So it is a little bit of trial and error when you're dealing with people coming into your home. But yes, I 100% encourage you to speak up in any situation that you feel uncomfortable with a caregiver, whether it is family or professional, whatever it is.
What are some things that that people should speak up about with their caregivers? Like, what are some behaviors from caregivers that a senior might put up with, but really are fairly unacceptable?
Well, in home care, we trust these people in the field to be doing what they're supposed to be doing and showing up when they're supposed to be showing up. So, is it possible that maybe they clock in and out and they don't stay their whole shift? Yeah. They get close enough with the client that the client doesn't want to tell on them. That's something you should be speaking up on. Those are your hours, those are your time, and they can't be billed if the caregiver's not there. So if you're in a situation where you have someone that's coming in late all the time and it's not okay with you. Some clients and caregivers get their own system, and they're like, hey, I dropped my kid off, I'll be a little bit late. That's okay. If it's a consistent thing that's bothering you, speak up. Things are missing out of your home for any reason, speak up. And we've got one client that wouldn't let anybody bring big bags in her house just as a precaution. You have rights in your home, and we need you to be flexible with us as we try to find the right caregiver for you. But if someone's putting their hands on you, someone's making inappropriate comments, and honestly, just while we're talking about it, we make that message the same for our caregivers. So we are advocates for our clients and our patients, but we also advocate for our caregivers too. We're not going to put them in a home where they're unsafe or uncomfortable. So we kind of have the same conversation with both. Like, if you see these things, we have to be made aware of it. And then not necessarily like a black and white list of rules. We have to go through our investigation and see where everything stemmed from. But for sure, any kind of abuse, neglect, they're stealing your cards, they're using your cards to buy stuff and not give it back. I mean, anything that could possibly happen as you get close to a caregiver and they're going to the store for you, or they're doing these things, I would just say be alert and be aware. And anything that makes you feel uncomfortable, even if it seems insignificant, because the thing is, if you don't speak up, then there's no way for us to know. And what if another person ends up having to go through the same thing? We want to know if there's bad apples out there. We want to know if there's people that we need to address and get rid of, or so any of those type of things. If it wouldn't be okay for a family member or someone to do it to you, we shouldn't be doing it either. It's your home. You should feel comfortable. So anything that makes you feel uncomfortable, I would say speak up about.
Good to know. So, all this talk about, the negative things, or how to deal with negative side of caregiving is definitely good information, but, caregiving isn't easy on the caregivers either. And, I think that, it's hard work, and sometimes caregivers can be almost considered heroes, for what they can do. Have
Absolutely.
you seen any lives transformed through caregiving? That seniors are struggling and they get matched with the
Oh,
right caregiver, and they just come alive and find themselves capable of.
absolutely. Yes. I mean, we have one particular person in Richmond. She's a caregiver that takes care of her 7 days a week because the caregiver works for us, and just we've had trouble getting people in there consistently. So we do have some other help in the evenings. It gives her a break, but she is just a form of attachment with her. She's there 7 days a week. We have another lady who absolutely was very opposed to having a male caregiver come in, because we do have male caregivers as well. We do always make sure that a female is comfortable with us sending in a male before we do that. But in this case, the woman wasn't real sure, and they're best friends now. I mean, it's almost like he replaced her son, and she gets out more and does things. She gets out and walks the dog, and it really is amazing what can happen if you put the right people together. I mean, I've seen it over and over again where people have just been depressed and sad, and then we send in the right caregiver, and now all of a sudden they're going outside some more. Maybe they're going to bingo, maybe they're doing more things at their senior living facility that they're in. So yeah, absolutely, I've seen that.
And I know some of the stories because this podcast and event schedule is set up by Signal Health Group. I'd love to hear or just share with the audience some of the hero stories, issues where people were really in need, and the caregivers just came through. And would you mind sharing any of those stories that you've got?
No, not at all. We have so many. So we have a couple ladies that we take care of that are pretty much shut-ins. They don't get out at all. So we have caregivers that make sure that they have their food and they have their things that they need. We had one lady, a caregiver, was calling in on a regular basis. We sent the office staff out. It was grocery day. She needed her food. So caregiver was calling in. We were looking for a replacement. We just sent the office staff out to make sure that she had the food and the things that she needed in her home. We've got caregivers that form such a personal connection that maybe someone calls in and they don't really have time to pick up a full shift, but they're like, hey, I'll go make sure they took their medicine today. I'll make sure they got their food because they live close to me. We do have issues with staffing. Sometimes caregiving is a very hard job and not everyone is cut out to do it. So we have office staff that we send out on a regular basis to make sure that these people don't go without care. It's a very important thing at Signal. If we commit to doing the hours, we don't take on patients that we can't staff, which is why we look at every referral before it comes in. But if we take it on and agree to staff it, it is very important to us that we keep it staffed. So if their caregivers aren't reliable, or we're finding out that maybe someone we hired is not going to work, then we put team leads or office staff in place to do that. So, I mean, we as office staff go to funerals of our clients. We touch family members' lives. We just had one pass away a couple weeks ago, actually, when you and I were in Georgia, and I missed the funeral, but she'd been our client for a long time, and her family, her daughter was just, and the woman she didn't always love us. We had to involve family and take care of her, and we didn't always make her happy as office staff, but her daughter was very thankful for those services that we provide. And that's really the coolest part of it, is to see the difference that you make all the way to the end of their life. But we have caregivers. I could probably sit all day and tell you stories about the caregivers that we have, the good ones. I mean, you get really, really good ones. You hear talk about the bad ones, but you get really, really good ones that love these people and they treat them like family and go above and beyond. We'll have to tell them, you're not doing things off the clock. You do things they just get so attached that they make sure that they're taken care of.
Yeah. Some of the stories I've heard through my involvement have just been crazy,
Yeah.
finding out through the grapevine that someone hadn't had groceries in days, and doing midnight food runs. And
Yeah,
one of our
one of the coolest-
franchisees was doing a wellness check on one of the clients, and ended up saving his life because he was
Yeah.
in stress.
And that was literally just because in Wisconsin, I know you're talking about, he liked fixing, he volunteered to fix meals or to carry meals into people. And this guy hadn't been answering his door, and he found him and saved his life. And that's something really little you wouldn't think about. It's not like he's in there performing heart surgery. He was just delivering a meal and helped save his life. I mean, there's stories like that all the time. And we are very person-centered at Signal. So one of the coolest things that we just did that kind of ties into caregiving is we had a caregiver that used to take care of one of our clients that passed away from cancer. And so not everyone is cut out to handle that kind of thing, and not everyone's cut out to come back from that. So she chose not to come back as a caregiver. It was too much. Her aunt died later of cancer, but she actually started a cleaning agency. It's Lock Cleaning Services, and she will go into cancer patients' homes and clean for free. So when I found out about that, I just promoted it to our team, and our owner said, hey, let's donate supplies. So we donated, asked her what she needed, and took the supplies and gave them to her. And that just was a really cool way to give back. She worked for us for a long time. So it's kind of a bittersweet story because she didn't come back as a caregiver, but it turned it into something great for her that she's doing that also still benefits our clients. So that's one of my favorite stories currently, but we get these stories every day, and it's easy. We get some crazy ones too. It's like I said, it's not an easy job. We're dealing with people, but the good outweighs the bad for sure.
Yeah. And if you find yourself in a situation where you need these services and you do end up with one of the bad apples, you need to feel empowered to speak up. And we can find new people until we get the right match. I mean, that's really what it is. There's so many different types of people out there. And when you get the right match of the caregiver with the person that needs the caregiving, it can really be a big benefit for both people in the situation.
Yeah,
And
I've always compared it to like a game of Tetris, because there's so many different time spots and there's so many different dates, and there's so many different people, and maybe one caregiver takes care of a couple people, or so it's almost like a game of Tetris, and it is finding the right match. And if you have the right agency that cares, they are going to make sure you find the right match. Now, if there's minor disagreements, we might ask you to be a little patient with us. If there's major violations, we're going to take them out right now. But it is a game that you kind of have to play to figure out what works for everyone. But absolutely always speak up. I'd say that's, if you don't take anything away from this conversation besides that, I would take that away. I mean, you never should have to sit in your home and feel violated, uncomfortable, scared to speak up because you might have to go to a nursing home. Like, we'll find you someone else. You don't have to put up with anything in your home that makes you feel uncomfortable. So I would always encourage you to speak up.
so if somebody is thinking that they might need services, what's kind of your recommendation for, trying to find the right caregiver match? I mean, should they start looking at family and friends and then kind of like move up and eventually reach out to an agency or reach out to a local area on aging?
I
What's
think
kind of,
the answer to that probably depends on their situation. I mean, I personally like it when they're thinking about it and they reach out to me and I can help them through the process. So I can't speak for how every other agency operates, but if you're in one of the areas where we have a signal, if you reach out to us, even if we can't provide the services you need, or even if you don't qualify, we're still going to help you navigate through the process. So just like this podcast, like, we want to be a resource for our seniors. So if you don't know where to start, call a signal agency. Even if you call the Indiana branch and you get me, if I'll direct you to, if we have one. If signal can't help you, then I will help you find another agency too. That's one way to start. And I like that just because I like the chance to see if we can help first. But if not, and you're not comfortable that way, maybe talk to your family members. If you guys have a plan and a caregiver, go to an area on aging together, because they can transfer you both to an agency. If you don't have a caregiver or plan, you can still start with the area on aging if you want to, because that's where I'm going to ultimately refer people that aren't set up yet. I just like to get in there first and kind of feel the situation out. But you can start in kind of any of those directions wherever you're more comfortable. If there's not a signal around you, or you don't want to reach out to signal, find someone that's comfortable Googling and look, do reviews of different home care agencies in your area. Maybe start there and see if they help. But an area on aging in your area is probably the best place to start.
and I imagine that also applies if you're in a situation where you're caring for a loved one, or if you are the loved one and someone's caring for you and you want to try to help them get paid for their services. They can probably follow that same model. If there's a signal near you, you can reach out, or another agency, or you can reach out to the local area on aging and say, look, here's the situation. Can you connect us with an agency that can help formalize our relationship and get Medicaid to help cover this?
Yeah, and
Because
really too, we also, if you go back to the first podcast, we have integrated health systems. They also do, they're a bridge between like the caregivers, the aging disabled, and the clients. So you can even start with a service like that can help you navigate. All you have to do is get to a person that knows the system. So an area on aging, a case manager resource, or a home care agency. And any one of us should be able to point you in the direction you need to go, whether you're the caregiver or the client trying to figure it out. We can point you in the right direction.
So if I were to, I guess, try to summarize what we talked about today, caregiving is the general industry of people that need help with activities of daily living, whether it's cooking, cleaning, hygiene related issues, getting dressed, the things that you have to do on a day-to-day life, day-to-day to be independent. When you start becoming unable to do those, that's when you start becoming eligible for caregivers through Medicaid, or sometimes through private pay, if you can afford it, or through long-term care insurance, or if you're a veteran, the VA can provide some of these services.
Right.
And then, working with your caregiver is all about finding the right match. If you've got friends or family that might be taking care of you already, that you can formalize that caregiving. If you qualify for some of these, like long-term care insurance, VA, Medicaid, You can formalize that and they can get paid for what they're already doing. If you need to bring somebody else in, an agency, that your local area on aging, your agency can help find the caregiver. And then it's just about finding the right match. I mean, getting somebody you don't know into your home can be scary, but if you get the right match, you've also just found a new friend that you can spend time with and talk with and share your life with. And so it's really just about finding that right match. And if things do go south, always communicate with your agency that's covering the care, and they can try to address the issues or find you somebody that might be a better match. And in a lot of cases, having somebody take care of the hardest things you have to do on a daily basis can empower you to do more of the things you are capable of doing. So it can give you a new lease on life in some ways, and relieve some of the burden for some of the hardest stuff, so that you can focus on the good stuff.
Right.
Is that a good wrap up?
I think it is. Yeah. And I would just encourage, maybe we end on, it's okay to ask for help. I mean, the generation that we're talking about, very, very prideful, and they, it's not easy to let someone come in and care for you. Not just because it's not easy to let someone come in your home. It's not easy to admit that you are ready for that, but it's okay. Yeah. I mean, because if you look at it on the opposite way, it's not that you can no longer do stuff for yourself. It's that we're empowering you to do more for yourself.
Yeah. And just remember, when we talk about the generation being prideful, we're not talking about you. We're talking about, the listener. We're not talking about you. We're talking about the other people.
Yeah, of course. Yeah, of course.
Yeah. You know how other people are.
Yes. Yeah. No one specific in this conversation.
No. All right. Well,
I mean, it would be hard for me to accept that. I get it. It's hard to accept help, but if you look at it from the other direction, we're just aiding you a little bit so you don't decline in other areas, and maybe strengthen you some too. So.
All righty. Well, thank you for your time, Nicole, and thank you everyone for listening today, and we will be back next week.
You've been listening to the Senior Reset Podcast. If you found today's episode helpful, please consider sharing with the seniors in your life, so they too can live stronger, healthier, and more connected lives. Find all our episodes or submit your questions at signalhg.com/podcast. This podcast is intended for informational use and not as a replacement for medical diagnosis or care. Always consult your doctor if you have a medical issue.